Ma'am, we are live now.
Okay. So, hello everyone. Welcome to the NEET MDS 2020 Periodontics group call. I'm Dr. Divya Gupta, your original guru for periodontics. And just hold on, I'll just connect with the YouTube so that we can have a live chat. I don't know, I'm not able to open it. Okay. It's not coming, guys. I don't know, I'm not able to open the YouTube live. Hopefully, it will be opened in a few minutes. Okay. So now, guys, all of you have completed. Okay. Just a minute, guys. I'm opening it. Okay. Okay. So now it's open and we are live, guys. Hi, everyone. Hello, everyone. Welcome to the recall session of Periodontics for NEET MDS 2024. I would like to begin the session with this quote. Exams and grades are temporary, but knowledge is permanent, guys. So, whatever after the exam, most of you might be anxious, will be discussing the questions, the answers with your friends, and मोस्टली हम सबके दिमाग में आता है अरे यार मेरा ये रॉन्ग हो गया पता नहीं अब क्या होगा सो टिल द टाइम आवर रिजल्ट्स कम वी कीप ड्वेलिंग इन दैट मूड वी कीप वी आर इन दैट मूड ओनली कि यार मेरा एग्जाम पता नहीं कैसा गया क्या होगा सो गाइज वन थिंग आई विल टेल यू दैट यू हैव वर्कड हार्ड फॉर एवरीथिंग you have since means during your preparation period, whether it was 6 months, 1 year, 2 years, or more, you all have worked very, very hard. Now, in this 10 days period, just relax yourself, analyze what all things you did, where you went wrong, where you were correct. Analyze yourself. I'm not saying that you don't analyze, but enjoy everything. Don't think about the exams. Go on a vacation. If you like some sports, play that sports. If you like to eat, to cook, to do exercise, do that thing. Whatever gives you a stress-free environment, be in that environment, guys. Okay. And one more thing I would like to say is the knowledge here it is written that knowledge is permanent. Whatever you learned during this period, during your preparation period, not only about your subjects in terms of your subjects, no, but also the experiences, whatever experiences you had, like um, most of you developed the attitude of not giving up, right? हम सब ने मेहनत की है, हम सब इतना पढ़े हैं. देयर वुड हैव बीन टाइम्स जब लगा होगा कि यार अब नहीं हो रहा, बट नहीं, हमने किया. वी spent a day or two when our mood was low, but still we came back, we fought for everything. So the experience, the qualities which you developed, like the passion, the perseverance, the attitude of keep going, keep those qualities with you throughout life. And I guarantee you guys, with these qualities, you will definitely be successful in whatever you do. Not only MDS, but in whatever field you choose after this. wherever you go, you will be successful. If you will keep this experience with you, the qualities which you developed during this period will be very helpful for you all. Okay. With that said, let us start our recall session. So, as such, the overall review which I got regarding the whole paper, the whole NEET MDS paper, whether it is part A or part B, it was a lengthy paper, guys. It was a lengthy paper. At first sight, you will feel that it is an easy paper because, you know, the topics were repeat. The repeat topics were there, repeat questions were there, might be, but there was some trickiness either in the options, or if you see that the topics are repeated, but the questions were very lengthy. Mostly clinical based questions were asked, or if some tricky question was there, even from the if the topic is repeat, the questions were very tricky. So even in perio, guys, the paper was a bit tricky. It was a bit tricky. Okay. So just excuse me for the writing, as I'm writing on the annotation tab and I'm not that much habitual of writing on it. So there will be little bit here and there. Okay. So yes, the paper was lengthy. The paper in perio, the questions in perio, 2 to 3 questions were direct questions. They were like very easy, but few questions were really tricky. Either the options or the questions were tricky. Okay. So the first question here is, reverse architecture is seen in. Reverse architecture is seen in option A, trauma from occlusion, option B, aggressive periodontitis, option C, osseous crater, and option D, Mecker's festoons. So the confusion here, Mecker's festoon definitely is not the option that you can easily negate it out, right? You can easily negate it out. This is not the option. But the confusion was between option C and option A, that is trauma from occlusion or osseous crater. Now, before we reach to an answer, let me tell you what is osseous crater. So, guys, osseous craters, osseous crater, it is a depression. It is a depression between the facial and lingual walls. There is a interdental bone loss. So, if this is the tooth, okay, this is the tooth, this is the facial plate, this is the lingual plate, okay, and this is the interproximal bone. So, when there is loss in this region, in this interproximal region only, and the facial and the lingual plates are intact, the facial and the lingual plates are intact, then it is called as osseous craters. Osseous crater is the most common bony defect that is seen, right? It is the most common bony defect. But in reverse architecture, what happens is, if this is the tooth, okay, this is the tooth we are seeing from the facial side, from the outside. This is the bone. This is the bone, okay. Now, here, the bone which is covering the roots of this tooth, this is the dental bone or the radicular bone, and the bone which is present between the two teeth. This is the second tooth, okay. So the bone which is present here, this bone is the interdental bone. This bone is the interdental bone, right? Interdental bone comprises of the facial plate and the lingual plate, as well as the interproximal bone. When there is loss of this facial plate, lingual plate along with the interproximal bone, when the defect is like the answer. The answer to this question will be TFO. The answer to this question will be TFO. So in this, the sequence will be like, if there was chronic periodontitis in this option, then chronic periodontitis will be of first preference for reverse architecture. Then the second preference will be TFO. After that, aggressive periodontitis. And after that, NUG. This is the order in which the diseases are seen, the epidemiology, the prevalence of the diseases are in this order. Most commonly, we see chronic periodontitis, okay, then TFO, then aggressive periodontitis, then NUG. So the answer to this question is trauma from occlusion. The answer to this question is, sorry, here I don't know how it is marked aggressive periodontitis, but the answer to this question is trauma from occlusion, okay. Now the next question is, rolled thick bands of gingiva present in the canine region are. So in this question, they are trying to ask that there are rolled thickened bands of gingiva present around the canine. What these bands are, you have to think that first, right? What these bands are. Whether they can be clefts, whether it is because of the recession. Definitely recession will not present as a roll thick bands, right? Whether it can be a triangular shape defects or a non-fibratic zones. So here they are talking about this. Here in this picture, you can see that there are rolled thickened fibrotic bands. There are rolled thickened fibrotic bands surrounding the tooth. These rolled thickened fibrotic bands are called as Meckel's festoon, right? Okay. TFO was there in the option, guys. So aggressive periodontitis is not the answer for the first question. It is the trauma from occlusion. Whether NUG was there, NUP was there, guys. Options were different. Okay, guys. Charvi, if you feel the question is wrong, the options are wrong, please let me know the correct option as well as the answer, as well as the options and the questions. I'll correct it. Okay. Now, the answer to this question, here you can see that what are Meckel's festoons? Meckel's festoons are fibrotic thick bands, right? And Stillman's clefts are, here you can see, here this Stillman's cleft. These are apostrophe shaped clefts which are seen. Mostly these two things are seen as the tissue is progressing towards recession. Okay. As the tissue is progressing towards the recession, you will see that there is presence of either Meckel's festoon or Stillman's cleft. Here, the thing which they are talking about is the non-fibrotic zone, that is the Meckel's festoon. The answer to this question will be non-fibrotic zones or region, which is the Meckel's festoon, or you can say that it is the Meckel's festoon. Okay. Now, the next question. Intercellular mineralization of plaque occurs due to which bacteria? Intercellular mineralization. Now, this is also not a repeat question. It is a repeat topic, guys. Many years back, this question was asked once. This question was asked. This we have discussed in our live sessions also. So this is a direct question, but a difficult one. Definitely, this is a difficult question to answer. Okay. So intercellular mineralization of plaque occurs due to which bacteria? Now, in intercellular mineralization, what happens during plaque mineralization is there are certain bacteria which possess certain complexes like CPLX complex. CPLX complex is calcium phospholipid phosphate complex. What is the role of this complex is it attracts the calcium and phosphate which is present into the saliva and forms a zone of nucleation or crystallization, foci of crystallization over which the calcium and phosphate will deposit, and it will help in the formation of a crystalline structure. Thus, it will result in the formation of calculus. Okay. So in this, the answer to this question is, this is a direct question. The bacteria which are responsible for intercellular mineralization, option A, Staphylococcus and Streptococcus. Option B, diphtheroids, Prevotella and Bacterionema. Option C, P. gingivalis and Prevotella intermedia. And option D, P. gingivalis and AA. The answer to this question is, guys, option B, diphtheroids, Prevotella and Bacterionema. Mostly the organisms which are responsible, most common organism is the Bacterionema, which is Corynebacterium. Most common organism to cause intercellular mineralization is Corynebacterium. Other organisms which are responsible are Tannerella forsythus, Campylobacter rectus, and some other spirochetes and filamentous organisms. Okay, so the answer to this question is option B. Okay, clear to you all? Asta, the way TF4 has angular bone loss and still the interdental bone will be above interradicular bone, whereas food impaction specifically affect, and this will affect the internal. Okay, so we will, I don't understand your question, whether you are asking me a question or you are explaining everything. Asta, I don't understand that. If you have any question, if you have any doubts, please post it. Now, the fourth question, GCF doesn't increase in which case? This is also a direct question, guys, and previous year repeat question. Option A, this is a simple question to answer. Option A, trauma from occlusion. Option B, smoking. Option C, toothbrushing. And option D, diabetes. Now here, you must know that the GCF, the flow rate of GCF increases in all the inflammatory conditions. It increases in periodontitis, gingivitis, and all the inflammatory conditions. And it increases in trauma from occlusion. It will increase when you will massage your gums. So during toothbrushing also, it will increase. As well as it will increase in diseases, systemic diseases which affects the gums. Diabetes is one such condition in which your gums are also affected. Okay. But one condition in which the GCF flow does not increase or it is decreased is option number B, which is smoking. In smoking, the GCF flow is decreased. The signs of inflammation are decreased. Though the inflammatory destruction is going on inside the bone, still the connective tissue destruction is there. There is more periodontal tissue, periodontal fiber destruction, more bone destruction is there. But still, the GCF flow is less. The signs of inflammation are less seen in smokers. Okay, so the answer to this question is B. Now another question. Question number 5. Which among the following does not have antibacterial action in saliva? So, okay, Danish, if Veillonella was the option, then you have to tell me with which other bacteria it was there. So we don't have to just look for one bacteria. We have to look for group of bacteria. All the bacteria should be, causing the intercellular calcification. So just don't look at the one option. We have to look at all the options before selecting the answer. Now, question number 5 is, which among the following does not have antibacterial action in saliva? Is it A, option A, lysozyme? Option B, lactoferrin? Option C, lactoperoxidase, and option D, lipase. This also is a repeat topic, guys, and we have discussed this also in our recorded sessions as well as in live sessions. The answer here is, we all know that lysozyme definitely has an antibacterial action. It is an enzymatic component of saliva which is causing destruction of the bacteria, right? Lactoferrin is a proteinaceous substance which is causing destruction of the bacteria. Lactoperoxidase is an other enzyme which has an antibacterial action. Lipase that is present in the saliva, it does not have any antibacterial action. It has a digestive function. It is responsible for the digestion of lipids. So the answer here would be option number D, that is lipase. Okay. Now the next question. Which among the following microorganisms are seen in nug? At first, when you look at this question, you will feel, it is very simple, yaar. Itna easy question, itna repeat. Nug is one of the most commonest repeat topic, right? It is the frequently repeated topic. So you will see at the options and you will say, easy, easier, easier. But then you come to the options and now read it. Whether option number A, Fusobacterium and AA. Option number B, Spirochetes and P. gingivalis. Option number C, P. gingivalis and AA. Option number D, P. gingivalis and Treponema denticola. Now here, confusion will arise between option number A and option number B, right? Fusobacterium is one of the most common organisms, microorganisms found with nug, as well as spirochetes are found most commonly found with nug. But guys, remember one thing. Apart from these two organisms, though it is called as a fusospirochetal disease, right? It is not only caused by these organisms. Other organisms of periodontitis are also present with them. It's not solely caused by Fusobacterium and spirochetes. That's why I told you always have to look at the other names also. With Fusobacterium, they have given AA. And with spirochetes, they have given P. gingivalis. Now, AA is an organism which is related mostly to the periodontal health, and it is the organism which is most commonly found with aggressive periodontitis, right? But P. gingivalis, we just have to think in a certain manner that P. gingivalis is a bacteria that is most commonly associated with periodontitis. Nug are what? Nug is necrotizing ulcerative gingivitis. It is an inflammatory condition, right? Nug is what? It is necrotizing ulcerative periodontitis. It is also an inflammatory condition. Wherever inflammation is present, P. gingivalis will be present, guys. P. gingivalis will be there. So here, along with spirochetes is the bacteria which is commonly present with nug, but along with it, P. gingivalis is other bacteria which is present. Apart from P. gingivalis, spirochetes, Fusobacterium, the other bacteria which are there with nug are Treponema is found, Treponema denticola most commonly it is found, Prevotella intermedia is found, then Selimunas are found. So all these other bacterial species are also found in patients with nug. So the answer to this question will be spirochetes. Okay. Now, the next question. Coaggregation is seen amongst. Repeat question, again a repeat topic, right? A repeat question, coaggregation. But once again, confusion develops here. Coaggregation is seen amongst gram-positive bacteria, gram-negative bacteria, gram-positive and gram-negative bacteria, and option number D, sorry, this is option D, none of the above. Now here, in Carranza, it is written very clearly that coaggregation, it is predominantly caused by gram-negative bacteria. Coaggregation is predominantly caused by gram-negative bacteria. So the answer to this question will be B. Answer B. That is the gram-negative bacteria. A difficult question and a tricky question, guys. Now the last question for this session is, a young adult patient noticed loss of interdental papilla and grayish pseudomembrane covering it. What will be your diagnosis? The options were option A, AHGS, which is acute herpetic gingivostomatitis. Option B, trench mouth. Option C, diphtheria. And option D, none of the above. Now, this is a relatively easy question, and also, once again, a question from NUC, which is very commonly asked, very frequently asked topic. So here the keywords which you have to pay attention is a young adult patient, loss of interdental papilla, and a grayish pseudomembrane. You have to remember that in acute herpetic gingivostomatitis mostly occurs in children less than 6 years of age. It is here you will see patient has fever, there will be ulceration, there will be stomatitis, painful ulcers will be present. Okay. There will be no pseudomembrane in acute herpetic gingivostomatitis. In trench mouth, what is trench mouth? Trench mouth is another name for nug. It is another name for nug. And in nug, you will see that most commonly there is a formation of grayish pseudomembrane. The patient has punched out crater-like lesions of the interdental papilla. Then there is a metallic taste, thick pasty saliva is present. It is mostly seen in young adult patients. So it is somewhat related to whatever clinical, keywords they have given here. Now, this third option is diphtheria. In diphtheria, you will not see, there will be a membrane formation. There will be a membrane formation, but that membrane will not be onto the gingiva or the interdental papilla. It will be at the back of the mouth. It will be seen at the tonsillar region, at the palatal region. Okay. There will be membrane, pseudomembrane formation, but no, it will not be on the gingiva. So the answer to this question will be trench mouth. Okay. So with this, we have completed most of the questions. If you have doubt in any of your questions, there were so many doubts in the live chat. So guys, just comment in the comment section. There might be some, options here and there. You just provide us the correct options, or if there were any other questions from Perio, do let us know in the comment section. We will be more than happy to, include them all in our session. Also, one more thing is, before ending this session, I would like to thank all my students, all my DBMCI students who have helped me with this recall. And especially, I would like to give special credits to Dr. Shreya. She has helped me a lot in this recall session. So thank you, Dr. Shreya. And also, we would like to introduce a new plan, which is Advanced Plus V.2 plan. The pre-bookings for the plan are open. In this plan, you will get pre-recorded videos. Nearly the videos are more than 600 plus hours for all the 19 subjects. Then there will be an extensive question bank included in this plan. The question bank has more than 20,000 questions along with the answers and detailed explanation to all the questions. Then there is a competitive test series, which you can give and you can, tally the scores with other colleagues. There will be clinical videos, more than 40 hours clinical videos are there, so that you will, along with your, conceptual or theoretical things, your clinical concepts will also be clear. You will also get hard copy of all the 19 subject notes. There are revision videos of more than 160 hours and daily mentorship sessions by Dr. Himani, our academic director. So the pre-booking offer is at rupees 18,799 only. I hope you all will avail this offer. And if you have any doubts, guys, just let us know in the comment section. And thank you so much. All the very best, guys, for your results. And just remember whatever I told you before the start of this session. Just stay positive, and whatever things you have learned during this preparatory phase, keep those values with you. Okay. Be determined always, and you will excel in whatever field you go. Whatever you choose, that will be yours, guys. Okay. So all the best and stay positive. Thank you.